Here is the secret to personalised support for busy anaesthetists. What we do is we have a unique set of rules based on what the doctor, what you want to have for your practice. We use those rules to configure our automation so that the system delivers exactly the experience to your patients that you want. We make sure that the questionnaires that we send out for you to your patients are using a template of your choosing. We can adapt the questions, modify things as required. Then you get the questionnaire back, you get the opportunity to see the responses, and if you're unhappy with the way the questionnaire gathered information, we can revise it on an ongoing basis. We have a team of people whose whole job is to take all these automation tools and adapt them and customize them for your practice so that your practice is presented in the way that you want it presented. We have a system that does it. We have a system that handles this high volume of accounts, which enables our staff to be focused on the edge cases. If you imagine that almost 80% of inquiries, questions, situations are largely routine, once the system can handle that body of work, it frees up the team members' time to focus on the 20% of complicated ones. Because then those 20% that are a bit complicated, which need their extra attention and their extra skills that they have based on their years of experience, they can then apply that experience to those complicated situations. We have a lot of patients on a day-to-day basis, but from each patient's point of view, this is their one big situation. If they are in for an elective procedure or a semi-elective procedure, they might have chosen their surgeon, or they might be there because they're getting a procedure that they've got some choice on. In many cases, they've got a procedure that they don't have a choice about. No one really wants to get a colonoscopy. So it's important to remember that for each patient, their episode of care is a unique, significant experience in their life. This is easy to forget when we've got a big number of patients in our system, that we're handling a big number of patients with largely similar scenarios. It's important that we provide that customised service to each patient to reflect and respect the fact that this is their one. Could be their only time or their first time in the medical system. They could be a bit overwhelmed, they could be a bit anxious with the outcome, they could be a little bit concerned about how it's all going to go. So we need to provide a service and support for them so that their experience is as smooth as possible.